upon coming in for the surgery day, it was easy. I got here bright early in the morning, went up to my room, which is a very nice room here in the Clemenceau. Had a great view and friendly staff. You just can't get that type of service and care in the States. I didn't feel like I went through surgery. Went home the next day and was able to start walking, taking walks that day, the next day with my wife. The recovery was super. Well, with the shirt off, you wouldn't know that I had surgery. 4 little tiny holes, and it was easy peasy. No negative side effects whatsoever. Everything's back to what it was before, if not better. My follow-up PSAs every 3 months have been as low as you could possibly get on the readings. Dr. Rabii is your man.
It's very, very mandatory for every man starting the age of 50 till the age of 70 to do yearly screening for prostate cancer. Why yearly screening? Because early detection can lead to early treatment and thus cure. Out of 100 men, 15 will be diagnosed with prostate cancer in their lifetime. So it's very common and it is asymptomatic. It has no symptoms at an early stage. When we detect prostate cancer at an early stage, we can cure it. And the detection is very quick and very easy to do. Basically, it's a blood test called PSA, prostate specific antigen, and a quick digital rectal exam.
I had my regular annual checkup in the States. Part of that is the blood work, which does many things, but also an easy one to include is your PSA. And that showed an increase to jump up from roughly 2 to 4.3 or 4.5. So I did a biopsy, and that biopsy showed cancer in 2 or 3 different places, but it was confined.
It's not only about removing the prostate and the prostate cancer, it's removing it and preserving vital structures around it, like the nerves that are responsible for the sexual function and the sphincter that is responsible for the urine control. That's why it's very, very important that the surgery is to be performed by a skilled surgeon. I
decided to put a call in here to my doctor that works at my school, a well-known doctor, held in high prestige here. And she said she knew of a urologist that I could see here. I said, okay, so I felt confident coming back here. Upon arriving here, I talked to her again and saw the doctor she recommended, a well-known doctor at a local hospital here. He said if I wanted to have it surgically removed, I need to go see just one doctor. Only one he would recommend here in Dubai. And I was very impressed with Dr. Rabii. His method of robotic surgery, which I'm a huge fan of.
So robotic prostatectomy is a minimally invasive surgery. The main advantage for the patient, the immediate advantage actually, is less pain, small scarring, and faster recovery.
Robotic surgery is fantastic, less invasive. But I was more impressed with Dr. Rabii and his experience, his leadership in the field. He is the leader in the field in robotic prostate removal.
Robotic prostatectomy offers a better outcome in terms of cancer control, in terms of faster recovery, and in terms of maintaining and preserving the functional outcome also of the patient. The quality of life is very important after robotic radical prostatectomy, and it is the best using the robotic approach.
Because I could have gone back to the States. There's several super hospitals in the States that I could have gone to, but after reading about Dr. Rabii, meeting Dr. Rabii, I would have flown here to have surgery.
With the help of robotic surgery, any patient who is a candidate for radical prostatectomy is a candidate for robotic radical prostatectomy.
There is no role for open prostatectomy anymore if you have the robot.